everyone. My name is Cosme Pacana from WordSpring Publishing, and we're in Davao City, Philippines. Beside me is Dr. Edward Cagape, author of the book entitled Self-Medical Diagnosis. Good morning, Doc, and thank you for allowing us to hold this quick interview in your house. In a nutshell, what's this book all about?
It is a tool or a manual for the person to know what's happening to him. Oftentimes, when you are ill in the middle of the night, you don't know what to do. You just feel that you're at a loss. If somebody or something could teach you to know what's happening inside your body, it's the most or the best thing that could happen to you. So this book is the right manual for a person to have residing in his house.
And what prompted you to write this book?
I have been in practice for the last 31 years, and most often, I see patients in their late stage. Cancer, the obstructive stage, acute appendicitis, has to do exploratory laparoscopy instead of a small McBurney's incision. Lung cancer in their late stage, breast cancer in their late stage, which could have been prevented or could have been managed earlier, and the survival of the patient could have been longer. So, it is a dismaying scene, my own experience, to see a patient could have been saved. We could have extended his life or her life for at least 5 years or 10 years if intervention could have been done earlier.
And what are the benefits for those who will read your book?
The reader will know by just mere reading what's happening to him, what's happening to her. Symptoms, signs are available in the book. He has only to read all the signs and compare it to what he is feeling. By comparing these signs and symptoms, he can readily make a diagnosis and can decide for himself whether this illness is his or is a different kind of illness. Because all the symptoms are written and there is a difference of diagnosis, meaning that he can compare this illness could be this one, could be different from this illness. So, it's up to him or to her or to the reader to understand what are the group of symptoms that could lead to the diagnosis that is being presented in the book. So, by just mere reading, the patient or the person, the reader, will understand whether he has to go direct to the doctor or to the hospital or he can self-medicate. By just mere reading, he will cut all the costs. He will cut medical care and the duration of his illness.
What are the risks, Penny?
The risk of knowing all this without the advice of a physician is great. Because oftentimes a person who knows what to do with himself will always think that he could be a doctor. The risk for the reader would be to extend or self-medicate, and yet he is making a wrong decision. That's why the book was written for him to give or to be given a know-how or the wisdom to whether to directly go to a doctor or self-medicate.
As a medical practitioner for several years now, what are the types of people who self-medicate?
You will be surprised that even in developed countries, there are a lot more people self-medicating than those in undeveloped or financially constrained people. They think that they could do away with the doctor or they can stop the illness or the disease by just self-medication without consulting a specialist. That's why I'm really surprised why a lot of people would say self-medication is much better than going straight to a physician, because this is a very high or very risky thinking.
That's in the Philippine setting. Do the people in developed or developing countries also self-medicate?
In the States, almost every person self-medicates.
How about in Europe?
In Europe, they always do. They self-medicate first before they go to a medical professional.
Is that so?
I was really surprised when I was running a website, diagnoseyourillness.com, and most often the questions that crop up is, how do you treat a disease, or how do you, what medications are you going to take for this kind of illness? In the undeveloped countries, they often ask for the best advice. They would ask, would it be better if I will be operated on, or I would seek a specialist? So it is really surprising that these people who are really financially stable could just self-medicate instead of going straight to the doctor.
Did you write this book to get rid of the doctors or to make people self-medicate?
Actually, the book could never be a substitute for a physician. The knowledge, the know-how of a physician can never be substituted by a book, because the book only presents a few symptoms, a few diseases, while the physician has all the 1,000 symptoms and diseases he learned from medical school. It could never substitute for the doctor. The problem is a lot of people are playing doctors. They play doctor to their nieces, they play doctor to their wives, they play doctor to their parents and to themselves. Which is, you cannot really convince a person to go straight to a physician if he thinks that he has the knowledge to do it on his own. The book will give him the wisdom, the knowledge to decide whether he has to go straight to the physician or he can dilly-dally, wait for 24 hours, take some medication before he goes straight to the hospital. It's just an eye-opener. It's not really a tool or a manual to do away with the physician and do it yourself. No.
Finally, is there something else that you want to tell our readers?
I wrote this book because of the dismay that I got practicing surgery for 31 years. You see a lot of patients coming in their late stage. Rectal cancer, which could have been operated on, and the survival rate of the patient could have been extended up to 10 years. You see breast cancer on the terminal stage, which could have been done early enough that you could do without chemotherapy or radiotherapy. Just a simple removal of the cyst in the breast, and she can survive normally. She will go to ripe old age without any chemotherapy. But it's a very disappointing factor for us surgeons, because we could have done something. Now, I wrote this book to address this problem, to correct this limitation of a person. It does not mean that it will substitute for the doctor. No, it's not that. It will give him the wisdom to decide whether what he is feeling, what he is ailing, should be seen by a doctor or not. So, by having this book beside you in your house, you will have the tool to say, oh, I have to see a doctor. Oh, I can take a medication for a while, but I need to see a physician later on.
Thank you, Doc, for your time. Thank you for enlightening the readers. Good luck to you and to your book.